Good morning. I've got Ilsa Hampton with me this morning, Director of Meaningful Aging Australia. Welcome, Ilsa.
Thanks, Beck.
It's so nice to have you on board, especially right now around that spirituality and that human connectedness right now with the rates of social isolation. So for those who don't know about Meaningful Aging Australia, could you just give us an overview around the vision and the values and the mission of Meaningful Aging Australia?
Sure, thanks, Beck. We're a membership-based not-for-profit organisation, and our members are organisations and groups that are supporting older people. We're the peak body for spiritual care and ageing, and a lot of people have an immediate sort of allergic reaction when they hear that word spiritual. They think that it's enclosed in religion, and they think that we're going to try and make them believe something or do something that they don't want to do, which is actually not the case at all. So spirituality, there's a lot of research now internationally about spirituality to show that it is about meaning, purpose and connectedness in people's lives, and then connection with certain domains. So connection with ourselves, with others, with creativity, with nature, and with some sense of something beyond ourselves or bigger than ourselves. And absolutely for some people that does include religious faith, but it's about our beliefs, values, traditions and practices, sort of however that's expressed. And it's such an important part of human flourishing.
Absolutely. So what are some of the support and resources that you provide your members?
So our main work is practical resources to help make this quite ephemeral idea about spirituality into something quite practical. And then the second part of our work is advocacy with government and key agencies to help to integrate these ideas into care models and ultimately funding models. We've gone part of the way with that in terms of the aged care quality standards, definitely picking up on a huge amount of content that is a complete overlap, if not an exact alignment with what we're trying to do. But in terms of those practical resources, there's quite a lot now. And I know you've had a good look at the website and you can see sort of the volume. Sometimes people get a bit overwhelmed actually with the volume of resources. Do you want me to give a couple of examples? Would that be helpful?
That'd be great.
Yeah, so actually just before we got on the call, we were talking about change and how we really want to support aged care to make the changes that need to be made. There's some fantastic work going on out there that we're absolutely backing, but it's not happening everywhere all the time. And one of the things we've found over time is that the people that are involved in implementing change haven't necessarily had the chance to learn about change management. Yeah. So senior executives usually have, or you would hope they would have, but people kind of middle management who are asked to implement things maybe have had no chance for any education in that area. So something we launched recently is this one, which is fantastic. Very unusual to see an elephant in aged care, I guess. This is Leading the Elephant, and this is a guide to bringing in change management approaches to bring in integrated spiritual care. So integrated spiritual care is where relationships are valued, where everyone's intrinsic worth is recognised, where there may be some deep expertise around deep listening, maybe mindfulness or rituals, things like that, but also that the whole system is pointing in the direction of social, emotional and spiritual support. So this change management guide is drawing on a lot of published evidence around change management and integrated spiritual care. But again, it is very practical. It's very grounded in the experiences of our members and our own learning from kicking around the sector for quite some time, and really exciting, has these action planning templates to save people time, because we know one of the major reasons that people don't do things is because they don't have time.
Yeah.
So in our advocacy work, we're part of the chorus of voices now that are pointing this out to government and others and saying we need people to be given more time. But meanwhile, we have to repair the plane and fly it at the same time. It's like, well, we're here, we've got all these older people that we're supporting, we've got all this workforce, and so we're trying to find ways to save people time as well. So by having those action planning templates and tools, like our stakeholder and communications templates, one I'm really proud of, it's this big Excel spreadsheet that is just available for people to just jump in and edit however they want to make sure that it fits their setting, but it just saves them sitting there, in front of the blank screen or the blank page going, where do I start? Yeah, exactly. So that's one example, which is one of the more, I guess, sophisticated and ones that may take a resource that will take a little while. You'd sit down and you'd kind of work through it. You'd dip in and out, but it is a concentrated piece of work. It's one to do, earlier in the day when your brain cells are fresher.
Do you think that management piece that you were saying that the middle level, that they may not necessarily have had the education in that space. And it's not just a change of processes, it's a change of culture and how we actually operate. So you've got those practical strategies to support that organisation through that entire process.
We do, bearing in mind that it's a guide rather than a course itself. So if you wanted to have deep expertise in the area, you'd want to do an accredited course. But it absolutely is opening up people's minds to a lot of the key ideas that are in the literature around what you do need to do. And the reason I should have explained that we do have an elephant, and it's called leading the elephant, is this fantastic metaphor that we came across in some of the literature, where it's really looking at, let's say you want to take an elephant somewhere. Okay, it's not going to go if it doesn't want to go. Yep. and the metaphor is that the elephant is our inner world. Mm-hmm. So if you're not engaging people in here fundamentally around their values and how they feel about what it is that they're being asked to do, in the end, you won't actually get long-term change. So you have to engage. So there's a kind of a rider, an elephant, or a leader, and an elephant. So you do need some planning, you need some systems, and you need some processes. And sometimes people really excel with making the plans, but you're forgetting about the humans, which is, I guess, the core of our work. It's the humans in the room. It's the older person. It's all the people who love them, and it's all the staff, and it's all of those networks. All of those humans are the most magnificent thing about aged care, but they're also the thing that makes it so hard. So to get really effective change that's implemented well, that really sticks, we have to engage the whole person.
Absolutely. Thank you for that. Thank you.
Yeah, that's okay. Actually, before talking about another resource, I might just jump into a comment that John Polaires made, because I think this fits in one of your earlier interviews, if that's okay.
Absolutely.
Yeah, so he was saying it's easy. I really noticed that. He's like, come on, people, how hard is this? My words, not his. But it was kind of like, you just got to be kind. You just got to be nice, you know. And I thought, yeah, like it's not rocket science, I guess, a lot of what we're talking about, which is what I would sort of agree with John. But I would disagree with the idea that it's easy, because if it was easy, why isn't it happening everywhere? And I think actually just relating that then to something that Jason was talking about when he was talking about Jason Burton from Alzheimer's WA, talking about person-centred care and the epiphany that he had when he was preparing for the Royal Commission. Mm-hmm. And because he was asking himself, you know, why hasn't person-centred care been fully implemented everywhere? It's been around for so long. And he realised that it's an approach, not something to actually implement.
Yeah.
Okay. And so both of these relate to this whole change management piece, which is back to if, you know, it's one thing to sort of have the system around you, if it's pointing, you know, in this direction, but we're saying now value relationships, you know, which is actually something that's over here. It's not easy. It is not easy if all of the measurements around your role, all the things you're being asked to do, all of your training, everything is pointing over here. It takes a huge amount of willpower to actually resist that or add in other things, you know, into this other mix. Yeah. It's not easy, but it should be easy. I agree with John that it should be easy because it is about our humanity and it is about the connections between people, which is what sustains us in life. And it's something that we do well in other parts of our life. So I think the place where it becomes challenging is it's that system of care. So we have to acknowledge that these relationships are happening in a context. Yeah. It's not just me talking to my neighbour over the fence. You know, that is pretty easy.
Yeah.
So yeah, depending. I was in this book launch this morning actually with Palliative Care Queensland, Julian Abel. Have you come across him?
I have come across him, yeah.
Yeah. So he was launching this book about the work they've been doing on compassionate communities in the UK there. And I asked a question because, you know, it's stunning. Like the results that they're getting are absolutely stunning in terms of finally we've got, you know, some wonderful data around the benefits of social connection. Mm-hmm. But I asked him, you know, does your book say anything about how to be compassionate with someone that we don't actually like?
Yeah.
Because and that's kind of the point as well, is that that's where it's not easy, is if you're being asked to have a genuine, kind, maybe even loving, certainly respectful relationship with someone that you don't like, that requires a whole lot of inner resources to be able to actually rise up to that and be able to do that with, I guess, grace. So again, that relates to a lot of our work is building that workforce capability. So we've got programs, we've got advice, we've got guidance, we've got all sorts of things that are all trying to help the system point in this direction where high quality care and quality of life can both be attended to, which assumes that there's impeccable clinical support there as well, of course. So just to bounce back to one of the resources as another example, which is at a completely different end of things. So, you know, one thing to sort of plan change management, you know, that's all big stuff and it does take a lot of investment. With COVID, we've been doing some quick guides and things, and this one's a really important one. It's quite sad that, of course, you know, people are going to die. Yep. It's also a normal part of life that people will die. And people working in aged care know that people die. That happens all the time. I've been planning a project with someone else who's going to do something wonderful in aged care. And I said, and you know, people will die during the project. And they were just like, oh, mate, you know, that's unlikely. I'm going, no. Like, they're at the ends of their lives. Most of them know that they're at the end of their lives, which is also why all of that, the humanity of the thing is so important. Yeah. But this little, it's just a one-pager. Mm-hmm. We've released as part of our COVID supports, because we think that really trying to build and maintain people's resilience, it's always important, but it's become even more acute during the incredible pressures of COVID. And it's called 1 minute moment when someone dies. So it's just a very short, reflective exercise, if you like. It's a pause that an organisation can give people permission to take. Just 1 minute. Okay. You know, it's not much to ask. And that's where I would agree with John, I suppose. This is not hard. So to actually be able to say to your teams, here it is, we've got it printed out, we've got it sitting around the place, take 1 minute and honour the life of the person who's died and honour what you have done for them. This is about the humans in the room. So that's, you know, it's a PDF, you can print it off, you can implement it, you know, without a lot of difficulty, I would think. Now, if an organisation's culture can't receive that kind of support or input, then I would be very worried.
Yeah, very much so. Very much so. And it's such an impactful thing to do, to sit there and reflect on the impact you've had on that person and that person's life as a human, considering you've been the one supporting them. So yeah, that's a huge problem if an organisation can't digest that to allow their staff that time.
1 minute.
And is that a free resource on your website, or is that when you become a member that you have access to that?
That one is a member resource. We've put that into a kind of bundle of things that we've put together for COVID. There are some free things that we've done as part of COVID. I'll show you another one, which is just here. I've got this pile here. Here we go. This is a wearing masks with hearts. So we've released that as a free resource. So not useful if you've actually got an outbreak. But if you are required to wear masks, actually many people know Cynthia Payne. Now, Cynthia contacted me via email a little while ago. I had on my mind a lot of concern I was carrying around the impact of the masks on older people. And then she emailed me and said, I'm really worried about this. And so I went, right, that's it. We're going to find a creative solution here. And people may have already seen when COVID was starting to hit internationally, there were some health services that started to do this overseas. So the image here is actually a woman from Stanford. And she developed a bit of information about how to implement it. And then we adapted it for aged care, and certainly acknowledging her work, and some of our members and others have picked that up. So you have a photo of yourself obviously smiling on your chest, so that when you're wearing that mask, the older person still has a sense of, again, the human who's here.
I love that, because PK Bevel was speaking about such a loss of emotion that someone living with dementia experiences when they can't see the emotion of someone when they're caring for them. And quite often it can be quite scary and confronting for them.
Yeah, that's right. So someone for dementia and especially, you know, people with cognitive impairment and really all of us.
Yeah.
And I guess that's something else that does come up again and again, is that if it's good for people with dementia, it's good for all of us.
Absolutely.
Yeah.
Absolutely. So over the next 6 months for Meaningful Aging, what is your vision for the next 6 months, especially during COVID?
Yeah. We've got a project that's coming to fruition that we've been working on for a few years, actually, and it is a digital project. And so the timing, I guess, couldn't be better in terms of the challenges of the pandemic. I've got a screenshot here. I'll show you.
One you said earlier.
That's right. So this is Akira. So we've literally, I mean, I became aware of, you know, there's so many challenges in aged care, and absolutely we work in solidarity with the aged care sector. We don't want to make things harder for them, because we know people are at stretch point constantly in aged care for lots of reasons. And so we're trying to be part of the solution, I guess, rather than part of the problem. So I could see one of the big issues which was presenting itself was the reality that personal carers, you know, there's 70% of the aged care workforce.
Yeah.
They are really the face, you know, of aged care. They are how people experience aged care in Australia, in their homes and in residential care, is through the personal carers.
Yeah.
And we're thinking, well, how can organisations reach every single personal carer with this important message about social, emotional and spiritual support, about the incredible value of the relationship? So again, some organisations are already doing a bit in this area, but are they reaching the entire personal care workforce really efficiently and really effectively with these key messages? And then we've got the aged care quality standards that now do expect that organisations will have literacy around spirituality in the way I've described it, so in the contemporary understanding. So how are you going to connect your personal carers, who are often geographically, you know, very dispersed, probably from called backgrounds, probably, you know, part-time or working shifts and things, when there's basically no money for professional development for personal carers, which is also just not right and something we're advocating around. So how can organisations reach all of their personal carers with this really important messaging around the significance of the relationships that they're having with older people? In some cases to reinforce what they're doing, and in others to introduce a new idea and to broaden their mind around explicit understanding of spirituality.
Yeah.
So we ended up with a digital solution. So it's Meet Akira. It can be delivered through text message, an email, or we also have it embedded in a SCORM file that people can put into an LMS. And it's a 10-minute learning experience that's engaging. It's been co-designed with personal carers. We've worked with academics, we've worked with service providers, and we've had some older people involved as well. So we're very confident that it's very effective in engaging a personal carer as they follow the journey of Akira. And Akira is going about her daily work, and we see her talking to 3 different clients, and she drops the relational ball. So she's doing the tasks, and the tasks are important. People need practical support. They need functional support, but she's not partnering with them. She's not valuing relationships. And one of the people has dementia in the story. And as she starts to experience, I guess, the pushing back that would naturally occur when you're not meeting people where they are, they will start to resist, they will start to feel annoyed, they will start to feel frustrated. And so she starts to feel more and more down in the dumps. She goes through a kind of reflective process thanks to the help of one of her colleagues. And then we see her have a go at re-engaging in a different way. So she meets the same 3 clients the next day, and the user is invited to help her do that. So there's just a little bit of an action where you actually touch the heart of the older person to get feedback from them about their experience, and you touch the heart of Akira to help her reconnect. And again, it's that tiny pause. It doesn't even have to be a whole minute when you're going client to client, but just taking that pause to ground yourself again, to prepare to interact in a relational way while you're doing your tasks. And so we see that her making a slightly different choice with each of the people on the next day, and of course having different outcomes. Now, we had also feedback from Christine Bryden, I'm sure you know, is a woman living with dementia. So she had a look at it for us to make sure that it was, suitable and appropriate from her point of view. And we were really happy that she's really supportive of Meet a Carer and really encouraging with the work that we're trying to do with it. So Meet a Carer is currently being used by some of the organisations that were involved in the development of the product. And then it will be available to all of our members from the middle of November. At our AGM, we're going to release her into the world on the 16th of November.
Exciting to reach that 70% of our workforce and have a consistent approach to how they're delivering person-directed care. Like, that's significant.
Yeah, I'm really excited. It's always, when you're working on something for such a long time as well, and I should acknowledge Prime Super actually co-funded it in the end, because it was one of the reasons why it took so long was trying to raise the money to do it, because we know our members don't have any spare money lying around. And so, we worked pretty hard and we're very happy when we got that sponsorship agreement with Prime Super, who are very enthusiastic about our commitment to aged care, older people, and to the workforce. And then, when we first started the prototyping and engaging with personal carers as well, and doing the workshops with the personal carers, every step you sort of always, is this going to be right? Is this going to land? But just the feedback has just been phenomenal from the personal carers. It's been proven to be a very effective way for them to, like, they connect with a carer. Like, we even had, when they were going through some of the prototype, they were responding like, "Oh no, don't do that," or they're kind of talking to her, and they're saying, "This is true to form. This is what my life is like. This is what my work is like." Yeah. And they're going from, spiritual care, that's about Bible studies at the start, to when we did the evaluation process. Oh no, spiritual care is about paying attention to the relationships. It's about deep respect for the person. It's about being there.
And I think that's just the thing to really get across to people, is it's so much more. And unless you are aware of that and are looking to educate yourself in that and the wider organisation, you really need to understand the meaning of spirituality to support your staff through those emotional relationships. It's more imperative right now than ever.
Yeah, exactly. I actually saw, we did a submission recently, Skills IQ asked for submissions around the reimagined PCW, as they were calling them, the personal care worker. So we did some work on a submission for that, because obviously we're very interested in how personal carers are trained and how that role is even conceptualised. And they included a comment in there which they were drawing on something that had been raised in somewhere else. But they included a comment where they were saying, let me see if I can get this right. It's basically that the downside of having something like consistent assignment, where you have a small team or an individual personal carer working regularly with the same older person, the downside is that if something happens to that personal carer, that the older person suffers. They become distressed. And I'm a bit shocked, to be honest, that people would not see it's better to have loved and lost than never to have loved at all. Like, this is our life. Like, to actually think that the pain of the grief of losing a close relationship with a personal carer compared with the absolute misery and suffering of being supported by an organisation that is not relationally connecting with you. Like, it's actually, it does my head in actually that a care system would even think that's okay. And I can only think it's because of the biomedical model and building it off a kind of health services system where those relationships are still really important. But if you're in hospital for a few days unless it's for something very serious, it's probably not going to ruin your life if people aren't highly relational. You want them to be, but you're expecting that clinical care tends to be the focus. And our friends working in healthcare, I'm sure, would want to, pipe up and say, no, the relationships and the spiritual support there is just as important. But my point is that aged care services are in long-term relationships with people. So this is not a compromise we can make. Those relationships have to be at the centre. Mm-hmm. Anyway, I'm getting a bit worked up.
No, and I agree. And I think coming from midwifery, there's very different, the institutional feel in comparison to the community setting, because the community setting has that really woman-centred family relationship-based approach in comparison to working in a hospital where it is really transactional. That mother comes in, the baby comes out, next person comes in. And it's the same type of thing when you're delivering care to a patient in a hospital. It's so different in aged care, and the transition over to aged care for me personally was the best thing I've ever done. To have that long-term relationship and that emotional connection with someone and having the capacity to do that, it's the best feeling in the world. And although you know that they're not going to be there for like forever, it's that connection that you've got at that point of time, which means just as much to that person that you're delivering care to.
Yeah, yeah. And that's another, again, from Julian Abel's presentation this morning, he was reminding us about just the oxytocin that we all get when we're connecting with people. Yeah. So, there's some biological factors there as well, and that we will live longer. The greatest way to help ourselves to live longer is by having good social relationships, and this is exactly the space that we're in. I noticed listening to someone being interviewed on the radio this week about the lockdowns in the Housing Commission towers in Melbourne that happened a little while ago that were very dramatic and very disturbing, because suddenly all these people that live in these very tight apartment, multi-story apartments were told that they had to stay in their apartments due to COVID. And the person that was talking was from a health service, and she was saying that they were really focusing on all of the social aspects of people's needs who are in those towers. Mm-hmm. And I thought, well, this is good. We need to think about that. It's not just about COVID. And what she talked about is all true and good. But it was interesting to me because what she talked about were, again, still needs like someone needed medical support for another condition, or someone needed, some other kind of clinical or some sort of referral or something. Yeah. I thought she was going to talk about they needed someone to be there. Yeah. They needed someone to get alongside them. Mm-hmm. They needed someone to pay attention. And of course we need referrals and we need specialists and we need all of those things as well. But this is, again, part of the problem with the system, is that it's kind of skipping that fundamental human need for connection, which is sort of back on, what we were talking about before. And it's a big part of the work that we're trying to support, is the ability for people to pay attention. And we also need to pay attention to ourselves, which can be very challenging.
Very challenging for some. I'm speaking to a neuroscientist next week that's doing a big body of work around the brain response to compassion and to empathy and to human touch. And I'm really excited to talk to her because she's been doing it for the last 30 years. And she's so interested in the aged care space because she thinks that's the missing link. She's very similar to you around, while that part of the equation is being missed, if we understood the data behind that and what the brain's response was on both sides of the equation, it would make a huge difference to how we interact.
I wonder if it would, but to be honest, just back to John Pelez, and it's easy. It's like, what will it take? What will it take to convince us that these things matter? Because intuitively, we know, like if we just think about our own lives, don't we know? Like, isn't it a kind of commonly held truth that these things matter? And that's where I think, it's good. I think it's great what she's doing. So don't want to be argumentative, but I am fascinated in what it will take to really, I guess, turn this ship around. And yeah, I suppose what will it take to get it valued? So maybe for the bean counters, they need that kind of data, because they won't let their lives be perhaps, data in terms of what they even need.
And I think that's it. Like, what is going to change the direction of what's currently happening? Like, what do people need to understand how important it is to have that human connection component in aged care? Like, what do you actually need?
And for me, it's models of care and support, organisational culture, funding models, and capability development.
Yeah.
So, one thing that we do is help our organisations, our members build capability around all of this. And that is fantastic. But then they have people coming to work with them who are maybe working shifts in another organisation that is not focused on relationships, and they have to spend, half of the shift trying to get the person back into the culture they're trying to support. And one of the reasons that can happen is because people are not trained like this. So in our Skills IQ submission, we specifically recommended that the training for personal carers, and actually I think it should be for everybody, but again, because they're the majority of the workforce, the training for personal carers should begin with the social, emotional and spiritual and psychological needs of older people and of themselves. Because you actually can't be effectively in a relational space with someone else if you do not have any self-awareness.
Yeah.
Okay. And when that person is challenging for whatever reason, that's, as we were saying before, you have to dig deep to be able to stay present and do what you need to do in that relationship. And so for that, you need self-awareness. So if the personal carer training could begin here, and then the other things are added. So understanding dementia, manual handling, the food experience, all of the different things that a personal carer does need to know. Those other things should be done in the context of the relationship between the personal carer and the older person. So I think actually if the majority of the aged care workforce, preferably all of the aged care workforce, were trained in that way, and then when they came to work in the organisation and the organisation prioritised relationships, because it's no good, this is one of the other really sad things, is that sometimes people get excited about these ideas, but then they go to actually work in a service that does not support that approach, and they get looked at kind of sideways or even into a bit of trouble if they try to pause for a moment with someone, etc.
Yeah.
Unfortunately, that still goes on. Not everywhere, but unfortunately it still happens. And so then it kind of gets squashed out of them. So for it to work, the organisational culture has to be pointing that direction, and then for it to flourish and thrive, it has to be funded. Yeah. So there is currently no funding really, especially in residential care, for social, emotional and spiritual support. Yeah. So it's kind of squeezed in, it's bolted in. Now there's some psychological services that are coming in some areas, but it's not just about a specialist sort of coming in to do a sort of an individual intervention, because the setting that the person is in will have a huge impact on their health and well-being, including psychological and emotional and spiritual. So coming in and kind of counselling someone individually when the problem is the toxic environment, that in itself isn't great. It's good to give that person some individual support, but it ends up being more like a Band-Aid. And that's where we need the whole system pointing in this direction, which is again where that funding comes in.
Absolutely. And for spiritual care to be underpinned pretty much by the whole new aged care quality standards and no funding available to support with achieving that, it's broken. Something needs to change.
Yeah. And then, back to, well, who's going to pay? Which I know is very topical at the moment. The Royal Commission's opening that up right again. I think which then cycles back to that, the big one around our, the social context, not just within the aged care service, but our society and how much we value support for older people. And if we're not willing to keep older people, or able, not just willing, but able to keep older people close in with us within our networks. I mean, obviously our family networks are generally quite spread out anyway now. We're not really living that, I guess, that village or sort of networked life. So it is very difficult to be supporting someone if they've got specific physical needs or cognitive impairment, things that can become very difficult. So if we're not able to do it in our families and communities, if we are going to need services to help us, what is the value that we're putting on that? And that's something, I'm not unique in raising that as well. It's a very well-known issue, which is been talked about for so long, and the Royal Commission's, you know, highlighted it even further. So I think we can only hope that there'll be some fantastic recommendations that will actually be adopted.
Yes.
Which is, everyone's like, oh, can't wait, you know, Royal Commission, but it's like, and then what?
Yeah, absolutely. Well, I want to do a 1-minute fact find with you, just so people can find out a little bit more about who Ilsa Hampton is.
Okay.
What was your parents' nickname that they used to call you?
I didn't really have one.
Okay, on a scale of 1 to 10, how good of a driver are you?
Gosh, I'm in Melbourne. It's so long since I've driven anywhere, Beck. I can't even remember.
Go down to a 2.
8.
At what age do you want to retire?
I will never stop. I hope contributing to the world, people around me. Whether I get paid or not, I don't know where the line is there. I would imagine, you know, go to part-time at some point and stop getting paid at some point, but I wouldn't want to put a number on it.
Excellent. Pretty much every single person has said that, and I love it. It just really shows how compassionate people are in this space, wanting to make a difference. What's your favourite ice cream flavour?
Vanilla. Really good quality vanilla.
What's your favourite junk food?
Red Rock Deli chili chips.
Oh, they're so good.
Yeah, they're a bit of a family favourite.
What's your favourite carb? Beer, bread, pasta, rice, or potatoes?
Pasta.
Pasta. I could eat that for breakfast, lunch, and dinner.
Yeah, totally.
So how many hours sleep do you need each night to function properly the next day?
Oh, gosh. Well, to thrive, which is more than functioning, 8 is lovely, but I can function on 6.
Excellent. All right. Well, thank you so much, Ilsa. I really appreciate your time and all of your knowledge and experience and expertise that you have shared with us. I'll leave all of the details with Ilsa's website, all of her social connections, everything for people to be able to connect with us or if they've got any more questions. But if you could leave one thing with the audience, what would it be?
Just a reminder, I suppose, that we do all need to love and be loved, and that includes serving others, whatever stage of life we're in, whatever our cognitive situation. This is what we need to flourish.
Okay, awesome. Thank you. I love it.
Thanks so much.